We're switching back to our roundtable discussions now and really turning towards our adult population and with a focus on active aging. As we mentioned earlier, the Council had established a number of public and private partnerships to work together to increase physical activity and good nutrition in our older adult population. I'd like to invite our team leads, Hannah, when she's done with photos over here, and Rafael Campos to join the roundtable. And Dr. Stephen McDonough and Jason Collins are going to facilitate this roundtable. So Dr. McD and Jason, maybe you could share kind of some of the outcomes from yesterday and then open it up from there. So however you want to take it. Take it away.
Well, I guess I'll start. So yesterday, Dr. McD, Cornell McClellan, and Donna Richardson, and a couple other people, Hannah and Raphael, were also in the room. We had a great roundtable discussion on active aging, and our conversation covered the work that the Office of the President's Council has done to date, and then really dived into the issues surrounding the need to change the conversation related to healthy aging. So I'm going to turn it over to Dr. McD for a brief background for our fellow council members who were not present during our discussion yesterday.
Thank you, Jason. We had a really productive meeting yesterday, and we're going to talk a little bit about, at the beginning, what the council is currently doing in the active aging area. They're partnering, like we partner with a lot of organizations and what we do with several key federal agencies and other external agents, external to the federal government as well. One partner is the National Institute on Aging, and it has an exercise and nutrition program called Go for Life. And it's based on, it's evidence-based, which we like in medicine, to make recommendations based on scientific information, to encourage actively aging people like myself, regular physical activity and good nutrition. Our council staff are going to work with the National Institute on Aging for a kickoff event for Go for Life in September of this year, September 2015. We're also working with the White House Conference on Aging. It's going to occur in July of this year. It should be a big event. The dates have yet to be set for the exact dates in July, but probably the first couple weeks in July. And the White House Conference is going to bring a lot of people together to discuss, they do this every 10 years, how federal agencies and the country as a whole can help with the large number of people like myself who are baby boomers, who are going to be getting a little bit older, how we can stay fit and not be in the nursing home too soon and live a productive life. So that will be very important, and our council will play an important role in the White House Conference. We're also working with a lot of private partners in our country to help work with active aging, and this is something we're getting into more recently, the last few years on the council. Stanford University is one that we have a couple of arrangements with. One is the Stanford Design Challenge. The council staff served as judges for a competition where students, university students in the United States presented different proposals for deal with active aging, and the winner for the 2014-2015 Design Challenge was a company called SPAN, and they've developed a device, are working on that to help people transition from standing and they're somewhat frail perhaps, getting down to working on the ground, a stepwise process to go from sitting or from standing to being on the ground, helping with gardening and things like that. So that was real exciting to see that. It's kind of adaptive equipment. The council is also working on promoting fitness across the lifespan with Stanford University. And there's a conference coming up in June of this year where we're partnering, and council staff will be going with that. There'll be 4 Stanford experts representing psychology, technology, and medicine and helping active aging population. There's some other partners that the Council is working with, the Council staff. One is the International Council on Active Aging. And aging population is occurring worldwide, in addition to our country and developing countries as well. And this looks at the international aspects of that. We have a memorandum of understanding with the International Council on Active Aging, and there's a active aging week coming up, and the council staff will be working with publicizing this and promoting physical activity for older Americans. Other potential partners that we've discussed, and this will come out in our discussion that are in the next 20, 30 minutes, are the AARP. There's an Aging 2.0, a small startup company that we're partnering with that's working with other startup companies in the active aging population. And also we have a very good relationship with the National Senior Games Association, where they were here last year, and I met with some of the staff, and Shelley and I are going to go to Minneapolis, which is near where I live in North Dakota, for the National Senior Games, and I'm going to see some people who are 30 years older than me who can kind of whip my butt in a lot of different areas, and I'm a competitive guy, and I will try to find some ways to compete. And I didn't have a chance to mention Give Me Five, but I've recently retired as a pediatrician, and one of my major activities is walking golden retrievers and our pets. And I had a dog die last year who was 15 years old, who she and I had walked 10,000 miles together. And now we have 2 golden retriever puppies, and it's the first time we've ever had 2 puppies from the same litter, and it's like 4 times the work of one. But anyway, I've gone from walking twice a day, a mile each with our puppies, to 5 times a day, because it's a survival tactic for me, because unless I exhaust them, they exhaust me. So anyway, I digress a little bit, but we had a great discussion, and some of the things that the council is doing, and this is kind of ironic for me that I've spent all my life working with kids, and I'm basically a kid at heart. And now that I'm older, I get to work with people my age, so I'm finally getting there. So.
Thanks, Dr. McD, for that great description of what the office has done in the space to date. And we hope through our partnerships that we will help shape how older adults can make healthier choices and increase their level of regular physical activity. Now, what I'd like to do is to turn it over to Hannah to discuss, give a brief update as to what we talked about in the meeting yesterday.
Happy to. Thanks, Jason. We had the pleasure of having Dr. Anand Parka and Robin McKinnon join us from the Office of the Assistant Secretary of Health yesterday, and they gave a nice update on the White House Conference on Aging and the process going forward with that, and a history of the White House Conference on Aging. We also talked briefly of some upcoming calls to action from the Surgeon General's office related to older adults and walkability and the call to walking. We had the opportunity to really hone in a little on where the council, as Dr. McD has done in the offices, are partners, and so really focused in on the Stanford Center on Longevity, the future with the National Senior Games Association, and then talked about the next steps in terms of new partnerships and how we can find new partners in the space to continue to build this, as we really are looking at the biggest boom of older adults starting now as the baby boomers age into this space. And so and our final thing we spoke about, I think, is what Hannah noted today, is the intergenerational idea and engaging our older Americans with the younger Americans to get them both active and moving forward and going from there. But what I'd really like to hear is we talked about some new partners, so I'm going to send it to Donna to talk about your upcoming trip with AARP and the potential for a partnership there as well. So, and happy to answer questions, so thank you.
So this hits home for me. I am 52 years old, a grandmother, and I am a very proud caregiver for the past 13 years. I took care of my father-in-law, who is passed away, and now I take care of my father, who has dementia. In doing so, it requires me to have 24/7 nursing care, but I do know he is one of the millions of aging adults with chronic illnesses, and I try my best to keep him daily stimulated physically, mentally, and spiritually. And I just want to say that it is an honor to take care of him, and I think that we need to do a better job in looking at programs that will provide services and support for our senior citizens. I think that working with the ARP, which I've done for the last several years, is one of those organizations that would be so beneficial for us. As of April 2014, they have 37 million members. And I think as an ARP member myself, besides the services and products and programs they provide, I love the discounts that they provide as well. But I think it's important that we encourage, educate, and empower our seniors. And the best thing that we can do is to show them love, honor, and respect.
And then also we were talking, Hannah just talked about the Surgeon General's call to action as far as walking and walkability, and then potentially trying to get AARP through their magazine to get raise awareness, and maybe even doing a senior walking day. So would you, yeah.
So they have a national conference coming up in Miami, May 13th through the 15th. Mm-hmm. I will be doing an activity session there and also will be speaking. I will be able to speak with the new president, and I will address some of the concerns that we have, but also give them the recommendation of maybe doing a partnership so that we could do a walking program with them.
And we'll be lucky, hopefully, that the call to walking will be issued in June. So we'll have an update, hopefully sometime in June, for the call to walking from the Surgeon General's office.
And then something else that was just talked about was the generational, trying to get multiple levels of, from grandparents to grandkids taking part, and we can look no further than the First Family as an example of a healthy, active family. And I'd like to turn it over to Cornell to talk about maybe trying to see if we can get First Family, and then also the whole Let's Move initiative that the First Lady is so involved with, maybe expanding it from, you know, active seniors to now, active schools to active seniors and active aging, maybe trying to bring them into the fold as well.
Yeah, thank you. Yes, we did talk about that yesterday, about how we thought that if we could get a partnership in regards to Let's Move, I think we even kind of said something about it could be Let's Move Always or something, from childhood to forever. But we thought that would be wonderful to, again, as we've been talking about, to magnify the need and the necessity, and that seniors are actually the fastest growing population that we have. And I don't know if we all knew that before yesterday or whenever, but that's an interesting idea in terms of how it affects our whole community and our whole society. And we thought that it was an excellent idea to kind of piggyback and partnership with Let's Move in terms of the visibility, as well as the partnership between the young and the old, to bring them together. You know, great ideas in terms of an overall walking day, but a wonderful thing in terms of children working with seniors and seniors working with children. We've always seen great partnerships with that and what that does emotionally and spiritually for those all involved. We also talked about, I think, how it could be great to also continue to work with the Senior Olympics and the senior champions, and maybe use some of those for ambassadors, you know, in terms of, we saw how wonderful the steppers were today, to use those, again, to magnify that and to find ways to use them to motivate and encourage other seniors to be active and to participate. And again, to use our position on the council to make sure that not only does America understand the importance of great fitness and nutrition and wellness, but the need for us all to participate and to encourage seniors to do that. Being a senior myself, I certainly believe in it. And, so those are some of the things we talked about. We also talked about, in terms of, I worked with Dr. Benjamin before the past Surgeon General in terms of the walking program, and we talked about also in terms of the WARP to encourage the strength component. We knew that it's a hand in hand, that it's important to get everybody started, to get everybody moving, to get everybody walking, but to really offset the fall prevention and things of that nature, we have to also incorporate the strength training. And we didn't want to, kind of put too much on people at once, but certainly make sure that that partnership is there.
See, and that's where I think the messaging, the messaging and amplification that we can do is so important, and joining forces with folks like AARP and National Senior Games and International Council on Active Aging, to kind of frame our messaging so that we're all in sync, on those messaging, on that messaging. So, yeah, I love it, and it's so important, that we've got to talk not just about cardiovascular, but, really the resistance training for all ages.
Yeah, that was something that we talked about yesterday as far as falls prevention. I'm glad you mentioned that because someone said yesterday the stat was 1 out of every 3 seniors will have a fall. And I have stories in my family, I'm sure all of us do, of someone that we care for that had a bad fall. And for me, it was my aunt. And after her fall, she could no longer walk. And that was the start of her a downward spiral with regards to her health. In addition to strength training, there were 3 components to preventing falls. It was flexibility, strength training, and then balance. So my question to the council is, how can we amplify it? What ways are there to raise awareness and spread the message?
I think, sorry to jump in again, but Go for Life that Hannah started talking about with us, which is the National Institute of Aging, to me, we don't want to start a new program. I know you're not suggesting that, but I know you're not suggesting that. But I think first and foremost, we would certainly go to our sister agency at NIH and figure out what kind of joint messaging we can do. I see Robin here as well, who was with us yesterday, and our director from the program itself. So I think ways that we can amplify the messaging and be in sync timing wise on what goes out and when. There's a lot of national health observances. So I think from a programmatic standpoint, I think all of those things you just mentioned are part of that program. But then again, when we look to our external partners, same thing. I know there are programs out there for falls prevention and specifically and mobility and flexibility and so forth. So I think it's just knowing where they are, when, what they are, and getting the word out.
And we talked about the upcoming Go for Life month, which will be in September, which is a good way for us to start the amplification of the messages behind Go for Life, which is this exercise-based program with the National Institute on Aging. And it's really a great way for us to start, as Jason, you were saying, building up the flexibility and the balance and tying in our other partners as well. So, and Karen Prosinki is here from NIA if we have true questions that none of us can answer.
Sorry, Karen, your name totally escaped me.
She's our expert here.
Jane, yeah, go ahead.
Thanks, Jason. I also want to remind everybody that the Let's Move Active Schools has a staff involvement component. And I didn't do my homework to see how many teachers, custodians, cafeteria managers, principals, assistant principals make up a school in the United States. But I know we have 25,000 employees in our schools in Miami alone. So that's a good way to reach an aging population that's still employed working in the schools through the Active Schools program. So I'd also recommend that as we amplify your messages elsewhere, we include those messages in the Active Schools program as well.
And I think one of the things that came from our breakout session, and especially with the partners that we were discussing with yesterday is the need for the council members to amplify this. So they were very excited about that. The work that they're already doing is incredible, but they made it very clear that if we could help to amplify that, and one of the things I think would be great is for us to, we talk about, flexibility and balance and strength, but for us to somehow find ways to promote that through social media, doing some kind of, like we do the things that we do in terms of messaging in regards to have particular members do that in partnership with those agencies.
I also want to suggest, because we did talk about that yesterday, that even in my community, I decided that one of my Give Me Fives would be at the Senior Citizen Center, and I would challenge other senior citizens to do the same.
Well, I guess, we have a lot of former athletes, well, also a current athlete, but I want to ask the athletes, I know, being an older athlete, that there are things that I just can't do anymore. I think all of us in this room have that feeling of, well, when I was younger, I used to be able to do this, but now. So what does active aging mean to you?
That's a really good point. I think a lot of it has to do with just taking care of your body. And I think as athletes, we are very knowledgeable about that. But I think the regular population is not, just normal maintenance. And when Cornell was talking earlier about the strength training, that's really important, dealing with injuries. And, these are things that with just everyone, recreational runners and things of that nature, they have to do those things too. And so I think it's just, as you do move to an older age, just taking more time to go through some things that you may think are basic or you've done in the past, and to help your body to be able to recover as you move forward.
Hannah, do you have anything else?
I would love to talk about the idea of finding some actual deliverables that we can work towards, that you can work towards as a council, and that we as staff can help lift up. And so some of what we had talked about is, we've mentioned a little today, but coming together and finding ways that we can lift up perhaps National Institute on Aging's Go for Life, or lift up through a messaging campaign the call to walking, or partnering with other organizations, or finding creative ways that you as council members can help lift up this initiative so that we can continue to build it and move forward and promote this idea that aging it's changing the conversation behind aging, because it's not just, we're not aging, we're not getting older, we're changing the direction it can go in, and incorporating physical activity through a day-to-day life would be great, whether it's walking, strength training, balance, your work in social media, lifting up our partners' messages. So it'd be really great to hear some of your ideas of some hardcore thoughts and steps of that, and go from there.
Well, I think Dr. McD had a great point as far as with pets and the importance of, as you get older, maybe having a companion dog. I know with my parents, they have a German Shepherd who has a lot of energy. Similar to Dr. McD, they have to walk him. Otherwise, it turns into a problem for them. So maybe you'd like to talk about that.
Well, thank you, Jason. Yeah, I don't know if we'll be able to do something next year regarding it, but I think looking forward to incorporate the pet owner community as a potential partner in helping actively aging population be more fit by getting out and exercise and just not letting your dog run in your fenced-in backyard. But the point I wanted to, as far as deliverable for the next year, it would be nice to approach the AARP to see if we can the next year have a couple articles in their magazine authored by council members, either talking about council programs or advice from the council member on the active aging issue. I think someone said yesterday, our meeting, that's the most published magazine in the country. and has an opportunity to let many people, 37 million people, probably get that on a monthly basis, what the council is doing, and give them some suggestions. So they may not be interested, or they may have too much, whatever, but I think we ought to approach them and to see if we can get a couple articles in the next year.
I think to add to that, there were some things mentioned yesterday. Cornell, Donna, Ian were talking about the specificity to provide people. People want to be told what to do, I think was your quote, Cornell, to make it easy for people. So to raise awareness, but also give them things to do. I also think that the steppers are just gold, and we should package that to, to evangelize that and say to, folks, maybe it's in that piece. Here's how to do that. Here's how many hours a week we do it. Here's the music. Here's the choreography. Whatever it is to get those people who are inclined to do something, make it easy for them to take that action.
And we can use Go for Life to start that process. They do have some really great materials that would help us at least lift up their message, and then as well as, utilize your brilliant in terms of ability to have this outreach, so we can do a little bit of both. So we're not reinventing the wheel, because these great programs exist, and we're lucky to have had the steppers today, because my goodness, I don't think I've seen any more energetic dancers on that stage. So, and they were very happy to be here. But I think utilizing existing programs that are there, whether it be NIA or Go for Life or other programs out there, so that we can provide advice in a way and work our way with our partners to lift up those messages would, I think, be a really nice step for this initiative.
And one other one that we talked about earlier was to ask the people from Let's Move if they are open to a sub-initiative for active aging to promote our partners' messages behind physical activity. That might be something else that, and I see someone from Let's Move here. Hi. Thank you.
So Kirby's here, and we'll take that. I know certainly the First Lady talks about intergenerational, the need for intergenerational, and while the mission says childhood obesity, she knows that it takes the whole family, it takes really the whole community, and it takes really changing our culture. So we're certainly we'll work with Kirby and Deb and take that and get feedback on how those intergenerational messages or how that can be integrated.
Yeah, I mean, the timing to being a council member during Let's Move era has just been phenomenal. And if you look at what Let's Move Active Schools has done and the training we had last year and what they're doing, 9 million kids, it's amazing. And we could have Let's Move senior centers, active senior centers or something like that, something that specifically targets the active aging population, that could be community-based. I think there's great potential there. I'd like for the council staff to discuss with Let's Move about doing something like that.
All right, I think that's it. Unless the council has anything else.
Hannah, you feel like you have?
I feel like we've got great next steps. So I just want to recap to make sure I wrote it all down properly and didn't miss anything in my chicken scratch here. So approaching Let's Move in terms of working with that organization in conjunction with the Let's Move office, our staff, and possibly OWASH as well. Working with the NIA Go for Life to lift up that messaging to create something there with a Go for Life month and amplify their efforts. The Surgeon General's call to walking, doing something in conjunction with that and the walkability, and then reaching out to AARP and possibly other partners to provide advice and articles. And the pet.
Sorry, maybe with the Humane Society or some other national organization that I could envision some awesome joint messaging among this group.
And they also said, Let's Move at Senior Citizen Okay.
There are some CDC researchers who actually are interested in the pet ownership and walking. There's a science base to it, so I think we could tap into them.
You're so right. Yeah, absolutely. And I know who they are, Hannah. So we'll remind me, and we'll get reconnected with that group as well. You know, one thing that strikes me through this conversation, we talk with Let's Move Active Schools and the kids. The kids don't necessarily think about it, but one of the reasons that those schools that are really getting it, understand that getting kids active not only improves their health, but it improves their cognitive abilities and concentration and time on task, and yes, those test scores. But kids don't, they just see it as play or physical activity or awesome physical education. When we move into the senior population or the active aging population, I believe the #1 thing that we as older adults or aging adults are afraid of is dementia and Alzheimer's. That's the #1 fear. And we're seeing more and more research that shows that older adults who are physically active are warding off dementia for longer periods of time. I don't want to misspeak on the research, so don't quote me on all of that, but we're seeing more and more in that space. So when you think about cognitive, how it affects us cognitively from young age to adults and older adults, it's really interesting. And if we can really, like I'm thinking with messaging with the different audiences, especially with our AARP and their reach about that cognitive piece, I think could be really strong. Could be really strong.
And that's something we can talk about with the Stanford conference too.
Yeah, in June.
In June with the physical activity across the lifespan. So they've got some cool research on that area too.
Perfect.
Mm-hmm. Thanks.
Great.
Thank you.
And I know she's not here, but I know we're working on having Billie Jean King be part of the White House Conference on Aging. Not confirmed yet, but you know, just know that we're engaging Billie in that space. I know she has done some great messaging actually in this space with in partnership with the International Council on Active Aging, and so I know she'll want to continue to be involved. All right, so thank you. Another great breakout session.